All right, and then I'm going to do just a quick introduction. Welcome everyone into our PCOS lecture. My name is Dr. Jen. I'm a pharmacist and diabetic educator if you have not met me before. And today we're going to talk about PCOS, insulin resistance, and how they are related to each other. All right, so first I'm going to go into screen sharing for you so that I can pull up the entire lecture. And here we are. Can you guys see screen okay? We're good? All right, thank you. All right, again, my name is Dr. Jen, and we're going to talk about Polycystic Ovarian Syndrome, right? Ovary syndrome, also known as PCOS, or also known as diabetes of the ovary. Okay, so those of you who have not heard of that before, it's a real thing. So what is PCOS? PCOS is a genetic issue, a hormone issue, a metabolic and reproductive disorder. It's a leading cause of infertility, and it is widely underdiagnosed here in America. PCOS can cause serious lifelong complications for women, and it is caused by an imbalance of our hormones. And I'm going to get more into the science of just that.
Diabetes of the ovaries. It is Polycystic Ovary Syndrome.
One second here. I included a clip from Dr. Berry and Dr. Jamie Seaman that I want us to listen to together. And I really love Dr. Berry and Dr. Jamie Seaman. That is someone new. She's an OBGYN. She's board certified. She's got her bachelor's in nutrition. She's an OB doctor, and she also personally suffered with PCOS and struggled through using the medication, through going to the typical Western medicine system. And once she figured out what the real struggles were and how to reverse her PCOS symptoms, now her new mission is to share that with women all over the world. So I took a couple clips. This is like an hour and a half long interview between the two of them. I took out a couple of clips for you guys to listen to because it's such good information. All right.
Diabetes of the ovaries. It is Polycystic Ovarian Syndrome, type 2 diabetes of the ovaries.
Oh, we were talking about diabetes of the ovary. So yes, the problem is we call it PCOS. We know these women have these hyperandrogenism symptoms. We know they're not ovulating, they're not having normal menstrual cycles. So what do? Is we typically throw things at them that just help their symptoms.
What I kept finding again and again in the research was that diabetes of the ovaries. It is Polycystic Ovarian Syndrome, type 2 diabetes of the ovaries.
Oh, we were talking about diabetes of the ovary. So yes, the problem is we call it PCOS. We know these women have these hyperandrogenism symptoms. We know they're not ovulating, they're not having normal menstrual cycles. So what do? Is we typically throw things at them that just help their symptomatology, but it never fixes the reason why they have those problems. And just like in my situation, at some point, if they want to achieve a pregnancy, they'll come off of them, they're not ovulating, and then we haven't fixed the problem. And now they're considered an infertility patient, and they have to spend a lot more money doing treatments and seeing specialists and things like that. So it is like diabetes of the ovary. And I always bring up, when patients have PCOS, I always discuss insulin and insulin's role, because some of these patients don't always have peripheral insulin resistance. So some of them do have a fasting glucose that's normal, but not always a fasting insulin level. So a lot of times they get screened with a fasting glucose or an A1C, and it's normal. And so the doctor's like, well, no problems with your insulin. The insulin resistance in PCOS is different in every single tissue. So they still maintain good insulin sensitivity a lot of times in the muscle, which is great. Why I described why a lot of professional athletes have PCOS. It's advantageous in that regard. But because of the insulin resistance at the level of the ovary, if you really want to treat it, you have to treat it just like you treat peripheral insulin resistance, and that's through dietary modification. The only known way to drive that insulin lower is by decreasing the amount of dietary carbohydrates that the patient is taking in. That is the only way. You can throw metformin, you can throw GLP-1s at these patients, you can throw lots of medications, and it might make the problem better for a little amount of time. But over time, if you're not controlling the dietary intake of carbohydrates, you're going to continue to stimulate the pancreas to make insulin, but that insulin isn't working at the level of the ovary. And so the only solution to that is to decrease the insulin.
Okay, guys. So a little bit talking about insulin A1Cs and how people can have a normal A1C and still have an insulin problem and an insulin resistance problem that is leading to the PCOS. And this is very important because a lot of times, like she said, people will come to the doctor, they look at the A1C level and they say, okay, you're not diabetic. We don't need to worry about the diet. Right? We don't need to worry about your blood sugar. And that's incorrect. There can be an insulin problem and a blood sugar problem way before the diabetes occurs. And between that inflammation and the insulin problem, that is what's leading to PCOS. All right. So I
what I kept finding
another
again
clip in here from this lecture because I really, really love it. It's absolutely wonderful. And it talks about why so many women have PCOS and have these insulin problems. Now, I included a little bit of information on what kind of fasting insulin level you're looking at to be normal versus being insulin resistant. So anything under 25 as a drawn insulin level, which just like a doctor can test your blood sugar in your blood, they can also test your insulin level from a blood draw. And with a blood draw, they can tell if you're fasting insulin where it's at. And under 25 is considered normal for an adult. And 3 hours after a meal, under 25 is considered normal. Now, we'll see people all the time who have very high fasting insulin levels, and that's where that high hyperinsulinemia, right? So with insulin resistance, leads over time. We're eating too much, we're eating too often, the insulin levels rise, insulin resistance occurs, and this does take years, but as the insulin resistant state occurs, it leads to hyperinsulinemia, which just means high levels of insulin in the blood. Likewise, cyclically, as the blood insulin levels are high, right? These link to each other. High insulin levels cause insulin resistance cause higher insulin levels, and it just keeps leading and keeps going until we change what we're eating. And if we do not change what we are eating, we cannot get these insulin levels down.
Again, what I kept finding again and again in the research was that effectively every single woman diagnosed with PCOS also had hyperinsulinemia. Which, we talk about as insulin resistance, but really there's a black and white number. You can check a fasting insulin. And so if someone has a normal A1C and they have a normal 1 hour, but you check their insulin level and it's 47, they're hyperinsulinemic. And that high insulin level means that they're at much higher risk for both PCOS and gestational diabetes, I think. Do you agree with that?
Yeah, so when we think about the progression to insulin resistance, then to prediabetes, then to type 2 diabetes, it starts with hyperinsulinemia. So the body will continue to put out tons of insulin in an attempt to make the glucose normal. As the insulin resistance gets really bad, the blood sugars will start to rise, and the first thing you'll see is an elevation in the fasting glucose level and the fasting insulin level. Then eventually, months, years down the road, the A1C will eventually rise. So if you have an elevated A1C, this has been going on for a long time, even though the hemoglobin A1C is a 3-month average of what's been happening with your blood sugars, that's the last thing that starts to rise. So if you're only using that as a screening method, you're missing a huge proportion of patients that really need intervention now before it ever progresses. And just to give everybody a little bit of positive note, is that because you can go up, you can go down. So this is something where you can have years and years of insulin resistance. You can go back down on the spectrum. You can normalize the glucose levels. You can normalize the fasting insulin levels. But it takes time to kind of, unpack this and to reverse some of this damage. But you can fix it. It is reversible as long as you have a functioning pancreas and liver.
Yes, I love it.
Okay, so huge information there. It is reversible. You can put the PCOS symptoms in remission, right? And that A1C, huge pointer, guys. Yeah, so many people look at the A1C number and they're saying, oh, it's a 3-month average. So my blood sugar and insulin levels have been out of whack for 3 months. No, to get to the point where your A1C starts rising, your insulin and your sugar levels have been high for a very, very long time. This builds up and builds up and builds up. Insulin resistance occurs over years. So it is going to take you a little while to reverse it. It does not happen overnight, but it is very achievable. Now, I do have one other researcher in here that I want to show you. And this is actually Dr. Jason Fung. So if you've heard of Dr. Jason Fung, he is a nephrologist. So he's a kidney specialist doctor. He's a world-renowned author now for his studies and what he has done in talking about insulin resistance. So he has wrote several books, one of which is right here called Life in the Fasting Lane, which is a absolutely great read, especially for someone with PCOS or an insulin problem. And he has reversed PCOS symptoms and as well as chronic kidney disease in patients with metabolic dysfunctions such as diabetes and insulin resistance. So he is absolutely incredible, and I caught a lecture of his. Now, if you catch his information online, he's a nephrologist. He's very sciencey. He is very in-depth, and he gets a little too in-depth for a lot of people. So I did take a clip out of here that is going to explain the actual science or pathophysiology and typical treatment for someone with PCOS. So this may be a little in-depth for some people, but it's really great information if you'll just give it a listen.
That's the bottom line. Too much insulin is causing the follicular arrest, which is causing all the cysts in the polycystic ovaries. So once again, if you look at the pathophysiology of what's happening, is that you've got the polycystic ovaries, which is caused by too much insulin. You've got the too much testosterone, which is caused by too much insulin. And the third thing is the anovulatory cycles. So, and that's of course caused because if you have the follicular arrest, you don't get the release. So everything is caused by too much insulin. So this obviously is really, really important because it overlaps with everything that we see clinically, which is that too much insulin or hyperinsulinemia is also very important for the development of obesity and type 2 diabetes, which are huge health issues that are clearly correlated to the presence of PCOS. And it's obvious to see why, because they're all caused by the same underlying disease of hyperinsulinemia. These are all diseases of too much insulin. So what you see is that in PCOS, so if we kind of go beyond the fertility issues and the sort of acne and so on, what you see is that there's a huge spectrum of disease, you know, cardiovascular disease, sleep apnea, non-alcoholic fatty liver, which is that picture of the liver, insulin resistance, type 2 diabetes, and so on. And all of them are really diseases of too much insulin. And it's not like nobody knows this stuff. So this is a review article from the New England Journal of Medicine. And in a very nice fancy picture, it shows you exactly what the problem is with PCOS. So if you look at the picture, the key is the hyperinsulinemia. You can see that the hyperinsulinemia goes down to the ovary, which tells it to produce more androgens. It blocks the sex hormone, the SHBG, the sex hormone binding globulin on the left, and it causes the obesity and so on. But again, this is pretty easy to understand that everything here is really a disease of too much insulin. And this is the part that sort of logic just breaks down. Because in medical school, you learn about all this stuff, and it's like, okay, well, if too much insulin causes everything that you see in PCOS, then what's the treatment? How about Clomid? It's like, okay, like, did you not pay attention here? Too much insulin was the problem. Why are you giving Clomid, which stimulates the ovary to, ovulate? It's like, how about an ovarian wedge resection? It's like, what? What are you talking about? If you slice a little wedge out of your ovary cannot produce as much of the testosterone. So a lot of the symptoms would get better, but again, you're not making the actual disease better because you never actually treated the hyperinsulinemia. Or you can go to other treatments like metformin sort of makes little sense, but how about birth control pills? It's like, is that going to reduce your insulin? If it doesn't, then what are you doing for this disease? Like, you got to go back to the root cause of the disease and fix it if you want to fix this disease. And the disease is so common and causes so much heartache that we treat it sort of in this crazy manner when we already know what the root cause of this disease is. It's like, it's too much insulin, so let's reduce insulin. That's the only logical treatment, which is why Nadia works with patients and says, oh, hey, all of them are getting pregnant. And it's like, it sort of makes sense why that is. So everything ultimately comes down to it, but if you look, this is a sort of standard treatment guideline. And again, this is what they tell medical students and family doctors and everybody. So here's the symptoms, and if you look at the treatment, it's fertility drugs, right? Fertility drugs, if you want birth control pills, insulin-secreting medications like glucophage, so that's an old medication of sulfonylurea where you would, metformin, which sensitizes you to the insulin, which makes a little sense, and IVF and stimulating drugs. It's like, okay, where in this all have you actually thought about the actual disease and what we're doing for this disease? Like, obviously, this is not the answer. And again, it's billions of dollars from the pockets of all these women. And it's sort of heartbreaking to hear all these stories of women who want to get pregnant and can't get pregnant. So they go to their, fertility specialist who says, you have PCOS. Let me give you some IVF for, $10,000 at a cycle. It's like, come on. Like, we can do better than this. This is not what we went to medical school for, right? This is not science. You got to understand the pathophysiology, then you treat it. How are you going to treat it? Well, obviously, if insulin is too high, then you got to lower insulin. And there's no drug that really does a great job of doing that. And that's why the drug treatments really are not that good. But what is fantastic is that you don't need drugs for this condition, right? You need to understand the disease and then treat it. So how are you going to do it? Low carbohydrate diets, ketogenic diets, intermittent fasting. All of them, at their heart, are reducing insulin. They're just trying to lower the amount of insulin. If you don't eat, your insulin is going to go down. If you eat very low carbohydrate diets, ketogenic diets, your insulin is going to go down. And that's all it is.
And that's exactly what it is. And that's what's crazy is women are spending so much money with fertility treatments and drug treatments to try to help with the symptoms, to try to return their fertility to themselves. And they're not getting anywhere. And they get to the point where they're using all these meds to treat the symptoms, to get the inflammation down, to get the symptoms to get better. And then once they resolve that, they still have to start up on the fertility treatments to try to get the body to drop an egg all over again. And it's not fixing the root cause of the problem, which you can actually fix with things as simple as intermittent fasting. Now, I'd love to take just 2 minutes to read a little bit from the Dr. Fung's book. This is the doctor that was just talking. And he talks about in his book, Life in the Fasting Lane, if you do not have this book was written by him and 2 people who now work for him, one named Eve and one named Megan, both of which have PCOS or did have PCOS. Now, Megan suffered from PCOS, non-alcoholic fatty liver disease, and type 2 diabetes. She was also overweight. And today she's disease-free, lost over 80 pounds, and is living in good health. She's a clinical researcher who focuses now on preventive medicine and helps educate people on fasting and proper nutrition. And I thought her story was amazing because I have people reach out to me all the time who say, I'm not overweight, I'm not having all these issues, and I still have PCOS. Why? My eating cannot be that bad if I'm not morbidly obese. Why am I suffering from PCOS? Her story is incredible. So at 27 years old, she ate whatever she wanted. She didn't gain an ounce. She was that girl walking around in a size 0, holding a soda in one hand and a bag of chips in the other. And in one of her high school yearbooks, her friend wrote, "I hate you because you can eat all the chicken nuggets and fries you want and seem to lose weight." All right. So when she was 12 years old, she was diagnosed with non-alcoholic fatty liver disease. Usually we don't find that in kids because nobody's looking for it. They don't look for it till much later in life. And that's a condition where excess fat builds up in the liver cells. When she was 14, she was diagnosed with PCOS, which is really scary, guys, that younger and younger people are getting PCOS. She was so thin that her doctors did not advise her to change her diet, but instead assumed that she would grow out of these conditions. But they were very wrong. Nothing got better for her. Her PCOS became so severe that at 22, her doctor said, "You're most likely infertile." 5 years later, she was diagnosed with type 2 diabetes. And this is what we see, guys. PCOS is occurring from insulin resistance. Insulin resistance over time leads to type 2 diabetes. Now, she was only 27 years old when she was diagnosed with type 2. She went home, she was upset, she threw herself on her bed, cried, hot mess. But when she finally settled down, she decided to do what she needed to do to reclaim her health, right? So she lives in Canada. She turned to Canada's food guide, and she figured since the experts created it, that is the way that she should eat. So she was eating 3 meals a day plus several snacks in between. And guess what happened? Now, instead of being skinny, she says, instead of being a skinny sack of fat, meaning having fatty liver, she became a large sack of fat. The eating caused her to gain weight. So she was a size 0 with fatty liver and PCOS that then gained 80 pounds by eating what the experts told her to eat. Now, months later, she was desperate, reached out to Dr. Fung, right? Dr. Fung immediately started her on fasting and applying his principles of good nutrition with low carb, healthy foods and whole foods. And within weeks, her life began to change. And now it's been 8 years since starting to follow Dr. Fung's recommendations. She's lost 86 pounds, kept it off, completely reversed type 2 diabetes, fatty liver, and PCOS. It's incredible. Now, the other person who helped write this book, his name was Eve Mayer, also same issue. For her, she started out weighing 300 pounds when she got her PCOS diagnosis and was desperate to have a healthy pregnancy. She had all kinds of fertility issues. She actually went in for bariatric surgery to help with her weight loss. She chose lap band. She shed a bunch of weight with that. And after losing 80 pounds, she was still pre-diabetic, still sick all the time, and still suffering from PCOS, which required her to seek the help of a fertility doctor to try to help her get pregnant. So now that she knows what she knows now, working with Dr. Fung, she said she would never have gone through surgery. It did not get her any of the results that she needed. But because of fasting and following Dr. Fung now, just talking about intermittent fasting and getting some low carb in her life, at 45 years old, she's no longer pre-diabetic, no longer suffering from PCOS, and cannot believe she is so much healthier than she ever was at 30, eating 9 times a day. So I talk about this all the time. You guys, if you're a PCOS patient, this is an amazing book. I talk about this all the time. We're eating too much or we're eating too often. And even when we're skinny fat, even when we're at the point where we have a toxic liver, it still matters. Your insulin level still matters. You're still giving yourself all this inflammation and leading to PCOS. So PCOS is a food and insulin problem. There's no negating that. 3 big pointers that I really want to point out to everybody is, number 1, it is a stressful diagnosis, because when you learn you have PCOS, you basically learn that you're in a pre-diabetic state. Whether the A1C numbers show you that or not, you are headed that direction. You may also be suffering from infertility, or you may be overweight or headed towards becoming overweight, but these symptoms are reversible. Now, number 2, the medications are not going to fix it. Prescriptions are not going to fix it. It can help with some of the symptoms, but then they give you stuff to help with the symptoms. Then they have to give you hormones to help with fertility. The hormones they give you to help with fertility cause mood swings and make you feel crazy at times. And then that can lead to depression, anxiety, stress on the relationship, which then further aggravates fertility issues. Number 3, our focus really just needs to be on food. Adding keto-like diets, carnivore and carb restriction like diets are the best, but they're also difficult to stick to. all right? Because of how restrictive they are. Honestly, long term, they cause plateaus, and people struggle with deficiencies in nutrients from doing things like the pure carnivore. So what's the solution to fixing this insulin problem in a safe way? Whole foods, foods that roam, foods that grow, less sugar, cut out the processed junk. That means no Starbies, guys, no soda, no energy drinks. Get some light exercise, literally just going for walks. And then vary your eating to your menstrual cycle. And for some of these PCOS girls, they don't have a regular menstrual cycle or a cycle at all. So we have to reinstate that cycle with food. So for those of our ladies who are not overweight, this is important to understand. I have normal weight type 2 diabetics that I have to counsel in the pharmacy all the time. Okay, this is not just an obesity problem, although obesity can add to it. Obesity can be caused by the insulin resistance and the blood sugar issues. This is not just overweight patients. There are normal weight PCOS patients, and there are normal weight insulin resistance patients. And either way, it starts out with that insulin resistance and leads up to diabetes over time. So how do you know if you're insulin resistant? Here are some of the signs here of insulin resistance. You know by the signs. You can do the lab tests if you want to. You can go to the doctor. You can get your triglyceride and your HDL levels taken. If your triglyceride divided by HDL, if that ratio is over 2.75 in men or 1.65 in women, you have metabolic syndrome, which is just a fancy word for insulin resistance. You can get your fasting insulin levels drawn. You can do all the labs. You can check out the symptoms. If you're having the irregular periods, if you're having all the symptomatology, you really don't need to spend the money on the labs. If you know it's a problem, you know how to reverse it, and we can reverse it with food. So how do we reverse it, you guys? Intermittent fasting. Dr. Fung knows it works. His patients know it works. This is why they wrote a book on it for these PCOS girlies. Intermittent fasting works, and following a hormone building food calendar. Dr. Mindy Peltz is incredible. This is her fasting cycle. I know it doesn't come up perfect on here on this, excuse it a little bit on my screen, but I can get you a copy of this. I get the calendar. It came from her book, Fast Like a Girl. Also an incredible book. As you can tell, I read it, binge it. It's great. Her information is fabulous, and her hormone building cycle is incredible to get your cycle back, to get regulation, and to get your hormones balanced. I simply, and the simplicity to it is honestly 3 weeks out of the month. I don't eat a lot of sugar. I don't eat like natural sugar, like fruit, and I overeat the vegetables. All right. I have protein and fats at most of my meals. I have some vegetables, but not meals that are all vegetable. I make sure I always have some protein in there. Week before my period, I allow myself 5 to 7 days of fruit, of less fasting time and more fruit, more cruciferous vegetables, more of the good carbohydrates my body needs to build estrogen and progesterone in just the right amounts to keep my cortisol, my stress levels low, and to help my hormone balance, because PCOS is a hormone problem. So we're using the Unicity Yerba Mate imbalance. We're lowering our sugar and insulin spikes. We're reversing insulin resistance. Yerba Mate tea is scientifically proven to return insulin sensitivity, which is what we need to reverse insulin resistance. We're preventing the overeating. We're using that balanced fiber so we don't get more fiber and less sugar in our diet. We're balancing the cholesterol with that balanced fiber. We're improving our mood with the theobromine and with the fasting. And then we're increasing our natural energy and getting up those ketones, as well as losing weight for those who are overweight and needing to reverse that. How does Unicity do it? Okay, how are we reversing insulin resistance with this? Tea and fiber, guys. I'm showing some of the benefits in yellow of the tea. In peach, there's some of the benefits of the fiber. But basically, the tea is for breakfast. We're pushing back the first meal of the day. We're allowing our body to make ketones, increasing the GLP hormones so that we're not as hungry first thing in the morning. 4 to 6 hours of not as hungry. This allows you to return insulin sensitivity to the body. Again, the yerba mate tea itself increases that insulin sensitivity. It helps with insulin sensitivity, not to mention skipping that one meal, giving yourself 16 hours without macros, takes down the inflammation, allows your body to burn fat for fuel, and gets that insulin level low and keeps it low for 16 hours out of your day. This is how you reverse insulin resistance. Then you have the balanced fiber to bind to the carbs and the sugar in your meal, so your sugar doesn't spike as high. Together, this is a power-packed combination. Then the second tea we drink between lunch and dinner, just so we don't snack, because it's the snacks, the constant eating, 6, 8, 10 times a day, that is where this builds up and becomes a problem with both sugar and insulin. So these are just some studies that the Unimate, our Unimate tea works better than any other competitor for yerba mate. The yellow is chlorogenic acid, the green is theobromine, and this talks about how our product is basically superior from stuff that you're going to find in the grocery store. Unimate works better than water fasting alone. We've had head-to-head trials on water fasting versus fasting with Unimate. The Unimate comes out ahead. It keeps people from gaining weight over time. And then our balance has scientific studies showing up to 50%, really, it's incredible, sugar spike using the balance right before your meal. So we have all the scientific studies from UNLV, University of Sydney, and Cleveland Clinic, and more. Health Canada approved product, and it works really, really well. So people ask me all the time, okay, so keto, low carb, carnivore, this is what we need, right? Yes, and yet you can't just go all in and just do keto, or go all in and just do no carbs at all, or all in on carnivore, because then you end up with weight loss plateaus. It's very difficult to do long-term. Carnivore, if you're going all meat, is very hard on the kidneys. And if you're diabetic and doing carnivore, you're already stressing those kidneys, guys. When you're adding all that meat, just more stress on the kidneys. So you really have to be careful with that. And there's a lot of nutrient deficiencies with going all in, low carb, all meat, all keto. We've seen so many people fail on these types of diets. So literally what I recommend, honestly, is doing the fasting with a diet that is keto-ish, carnivore-ish. You're still allowing yourself carbs from time to time. As in, when we're talking about carbs, guys, we're talking about not Doritos and Oreos. We're talking about fruits and vegetables, right? Building up the fruits and vegetables during certain times of the month where you're needing better hormones. So you're needing to balance those hormones, get the estrogen and progesterone levels where you need them, keeping that cortisol low. The benefits of fasting, there are just so many. You can balance your weight, your hormones, your energy level, fix your sleep cycle. You can have carnivore days, keto days. You can flex your diet. You don't feel restricted. It's something you can stick with. I personally do a low carb or carnivore or keto meal once a day. I do eggs and avocado for lunch 5 days of the week, usually, okay? And then for dinner, I eat whatever I want. I just drink the balance first. I still allow myself the carbs, but I don't have that high sugar spike, and I don't have those insulin issues. The idea behind this, guys, is to get off the prescriptions and to get healthy. So with that being said, all right, I want to turn it back over here, guys. Let me get off of screen sharing and come back to you here. All right, can you see me? Am I back? Okay. You guys, let's see if we can see our chat. So sorry about that. Oh yeah, Tracy, it is a great book. So much helpful information. And I'm talking about both of these guys. Honestly, I binge the books. Can you guys tell? I'm after it. I'm reading them all the time. Fast Like a Girl is just absolutely incredible. For every woman who is on an intermittent fasting journey needs to have this book. Like, there's just so much good stuff here. Dr. Mindy is just absolutely incredible. The Unimate tea and the balanced fiber we have makes fasting easy. The fasting is amazing science. Yes, the yerba mate does help with insulin sensitivity, but it is the fasting itself that is doing the incredible work here, you guys. And both of these, Dr. Mindy and Dr. Fung, they're not with Unicity. They're not plugging any products or anything crazy. They're talking about time-based eating and how amazing it is for your body. It's just hard to do. We have the tea and the fiber to make it easy. We have the tea to help so we're not craving all the time. We have the fiber because it's good fiber, and most people aren't eating enough fiber. Yeah, and as well as that, with that fiber, we can have carbs from time to time, which means when you go to your grandson's birthday party and you want to have the dessert, or you want to enjoy, or he made you cupcakes or cookies that day and you want to be able to still indulge in some of those things or have those things with him, right? You can still do that. You drink the balance first. This is about not having restrictions in your life. This is about having balance in your life. This is about making things easy. This is about, I can go 24 hours fasting one day. I cannot fast the next day. I can go 16 and 8 for a week, and I feel good no matter what. I'm balancing my hormones. I'm getting in good nutrition. I can still have dinner with the girls or breakfast or brunch with the girls on a Sunday if I want to, guilt-free, and not mess up my diet, right? Because we're not on a diet. We're on a lifestyle system. We're eating good food. We're eating good nutrition. So you guys have any questions for me? And you can unmute yourselves and talk if you have questions, or of course, always put them in the chat. I know we have a couple gentlemen on here today. So this is information for you to be able to talk to your wives, your nieces, your aunts, or whoever in your life may need this information. Yeah, so your sister had cyst after cyst over years, and now she's asking what you've been doing. Okay, Stephen, this is wonderful. So this is information that you can share with her. I will make sure you get the slides and you get the recording so that you can share that with her. It's great information, you guys. Honestly, insulin resistance affects every chronic disease out there, and PCOS is one of them. It takes away the symptoms, it takes away the pain and the inflammation, and it reverses the cystic issue. It's just incredible, just doing time-based eating. Oh, good. You'll be sending them a recording. Of course, yes. Thank you, Tanya. So, and you guys, I put clips in there from various doctors like Jason Fung, like Dr. Seaman, because I want you to hear it from someone other than just me. I want you to hear it from people who aren't talking about Unicity or on Unicity's payroll, where you feel like, hey, this is something, you know, Unicity is saying they can reverse PCOS. No, I'm really seeing Unicity reverse PCOS. We have Unicity babies all over the place now. We have people coming to me and saying, this has reversed my pain. This has reversed my inflammation. This has given me fertility back. This has given me my life back. I have lost weight with this. It's just been absolutely incredible for so many people. We have a couple of PCOS girlies on our team who are newer to the team and just starting their journey with PCOS and with Unicity. So we cannot wait for them to share their stories, because I know they'll have nothing but success with this. I have seen nothing but success with this. When I get on the large team meetings that are all of North America, and the leaders reach out and say, okay, what have you seen with the system? What has been your wins? And the number of people who put reverse PCOS, reverse PCOS, reverse PCOS, reverse hormone issues, reverse early menopause, reverse is just incredible. I know this works. I have nothing but good things to say about getting rid of the inflammation and getting rid of the PCOS symptoms. You can absolutely put it in remission, just like Stevens put type 2 diabetes in remission. It is achievable. It is readily available to you. Yes. Oh, you don't need any more kiddos? Okay, well, part of being healthy is having a normal, fertile working system. So that can be a side effect of being healthy, just so you know, guys. Part of losing weight and being healthy can mean restoring fertility. So there's your warning there. Be careful, okay? It's wonderful. You can see how time-based eating and Unicity is changing lives, health, and reversing illnesses. It really is, Tracy. I have been nothing but excited. It's been a wonderful blessing to be able to help people get off of medication, instead of, as a pharmacist, I constantly see people getting on more and more and more meds, and to see them getting off of medication, to see them reversing illness, to see them taking down inflammation, reversing neuropathy pain, reversing PCOS pain. It's just incredible. It's just incredible. And yes, that fertility is a side effect of that. So yes. Thank you so much, everyone. Thank you for joining us today. I will make sure that I get this. I will have this recording. It takes about an hour to download, and then I can get it out to whoever wants it. Share it. Talk to people about it. If anything, at least maybe you can let them see that this condition is reversible with food, that this condition can be reversed with eating the right food. And if they need help, hey, we have Unicity that can help them. If you got invited to this, please reach out and chat with the person who invited you. So Carmen, you got off Unicity for about 2 months and you got started in May. and you're coming back because it worked. You're back now and you notice your blood pressure is normal, and just 3 weeks in, your sugars are still little high, but you feel great and you're fasting again. Your sugars are going to take a little time to come down, Carmen. So what happens is if you've been insulin resistant for a long time, if you have fatty liver, if your numbers are really high, it can take a little while using the system to get your sugar levels to come down, because what happens is your liver is so bogged down with the extra triglycerides, your cholesterol is off, you've been storing sugar in your liver for so many years that what happens is when you're still fasting, your blood sugar is still high because your body is going to reach into that liver first. And if it is full of sugar, it's going to release that sugar into your bloodstream, and it's going to have to go through your bloodstream to be processed, used for energy to get out of your body. Okay. So unfortunately, you're going to detox that liver before you're going to see your numbers coming down. You're going to have to release all that glycogen storage, release all those extra triglycerides that are just really high, in order to get back to baseline. So we can do it, girl. We can get you back on here. Yeah, we'll get you back going. So for some people, we will see some people who are type 2 hop onto the system, and right away their blood sugar levels are coming down. They don't have an insulin sensitivity problem, and they don't have a liver problem. Okay. Some people have really bad insulin sensitivity, or they have a really toxified liver. And if you're one of those people, it's just going to take you a little longer. Doesn't mean it's not going to happen. It just takes a little longer. So we do see some people where they're more than 3 to 6 months before they're seeing the wonderful results that they really, really want. So please be patient. It will happen for you. There's not a single person who hasn't stuck with it, who hasn't gotten the results that they wanted. I see it every day. So yes, no problem, Carmen, reach out to me. I'm glad you saw my text and you hopped on. So thank you guys so much, so much for joining us. I'm going to get a recording of this and get it out to everybody. Berry tea. Ooh, the berry balance is great. Will they ever make a berry tea? I hope so. I hope so. I actually had someone ask that before, and I've already passed that on to the higher ups to say, hey, let's try another citrus flavor other than just the lemon for the tea. Yeah, no problem. No problem, Tanya. Thank you guys for joining me. Yes, thank you. And welcome back, Carmen. We're glad to hear that you're doing well. I love you guys. I will see you all tomorrow morning, hopefully, on Walking with Wellness, right? Walking in Water. I'm going to be on there 9 a.m. Central Time. If you miss it, that's okay. If you are up and out of the house way before me, good for you. Get up and walk it for that hour. Get that walking in. Get your water in. At least get that water in. Get some good protein in, guys. You can absolutely do it. I'm so excited about it. Post pictures of yourself at 5:30 a.m. Yes, Stephen, we want to see them. We want to see them, guys. Hold yourself accountable. I want you guys getting in that Facebook group. Post pictures of yourself walking. I don't care if it's just your shoes on the treadmill or your shoes outside. Post pictures that you're walking. Post pictures of your water. Let's inspire that group. We've got like 400 and some people in our group. Let's inspire them to up their water game, to get their walking in. Let's post pictures of our protein. Let's inspire each other, motivate each other, blow up that Facebook with all the good stuff, guys, with all the good stuff. And Brianna, if you missed it, you will get the replay. No problem. All right. Love you guys. And I'll see you all tomorrow. Thank you so much for hopping on.